Hi, I'm at Intuitive Surgical in Sunnyvale, and I'm here to show you the aspects of the DaVinci SI. The motto of Intuitive Surgical is surgery beyond the limits of the human hand. I'm going to explain to you how that occurs and what that is. There are three components to the DaVinci system. Here is the controller tower. It is a one-button actuated system, easier to turn on than your computer. Turn it on, light cords and cables, and all of the computer and all of the technology is contained within this upgradable and very efficient. This is the patient cart. This is what is attached to the patient. What a surgeon does is he'll put the ports into the patient, and there are one camera arm and three working arms. This is an example of how they move. The unique feature of this is once it's placed within the ports, there's a rotational fixed point so that any movement that occurs around this fixed point, so there's no injury to the patient's abdomen. The purpose of this system is to bring precision and control from the surgeon to the patient. People think that a robot is something that's going to be doing something. This device does exactly what the surgeon intends it to do in a very precise way under high definition, binocular, 3D magnification, and what is referred to as endo-wristed instruments. Here is an example of an endo-wristed instrument. It opens and closes, it rotates and pivots, it goes in all directions, and you can see that this is smaller than the human hand and will do more than the human hand. This here is a grasper. What we have across this wall over here is all the various instruments that are adaptable to the DaVinci system. This is the surgeon's console, and this is a customizable to a physician. They put their name in, and the height, angulation, and armrests are placed precisely to their specification. The master controllers translate the surgeon's movement precisely and instantaneously to the patient cart. The controller of this system, you can come in here,
yep,
are these controller arms. Physician puts their head within this vision system. I can see a binocular vision, and I'm able to then move my instruments. This is very intuitive. It is very precise. I open, I close, I rotate, up, down, and there's all motions in between. Very fluid, there's no resistance at all. This is open and closed. This is up, down, left, right, rotation, and then any combination of these motions are available. Notice how I can get into very tight spaces, have precise control. Another feature of this is a feature called scaling, where very large movements of my hands, right now I move my hands about 8 inches, but I'm only moving the instruments just a few inches, so I can reduce tremor and get very precise with what I want to accomplish. The intention here is to get the best clinical outcome for our patients with the minimal amount of incisions and trauma to them. Get them out of the hospital quicker, reduce our length of stay, minimize blood loss, and provide superior technology to our patients.